We are back talking men's health with Dr. Richard Natale. He is a urologist and men's health specialist with Carolina Urology Partners. That's in the Charlotte, North Carolina region. And today we're going to be exploring Peyronie's disease. So, Dr. Natale, this is a bit of a sensitive subject for many men. And I want to know, first of all, what are the signs of Peyronie's disease?
Yeah, absolutely. I can't agree more. I'll be frank with you. I think of all the different issues and disorders that I treat as a physician, this seems to be the scariest. Even though there are ways to fix it, it is the scariest because something is changing. And the first thing that people think about is oftentimes they think about a cancer. They get really worried and worked up. I totally understand it. And that kind of leads into why they feel so and what the symptoms are. Well, in the beginning, some men may notice penile discomfort, particularly like one focused area of the penis. They may start seeing the changes that come with Peyronie's, like curvature problems. So the curve we think of, up or down, right or left. But even sometimes they'll notice a narrowing of the penis, maybe a contraction or shortening of the penis. So this is all kind of happening relatively acutely. So that leads us into this idea of acute phase of disease, where the actual inflammation of that area is starting and the changes are happening in present tense. Once those changes kind of set up shop and everything is more stable, you're not getting as much pain, you're not getting any more curved or narrower or wherever the circumstance, that's called a chronic state of disease. And at that point, a lot of guys will also feel nodules on their penis. So, and you may even feel them in the acute phase, of course. You may start noticing a thickening or what we call a plaque in that erection body that is leading to that curvature or those changes. So those are the symptoms that we'll see very frequently with men who have Peyronie's disease.
How common is Peyronie's disease? Do you see a lot of men in your office who are showing signs of it?
Yeah, it's interesting. I would tell you that the textbook answer was always around 10% or less. My very, very strong suspicion, and I haven't seen more recent population studies, but my very, very strong suspicion is probably more than that. I would almost guess potentially double. And I say that because a little bit of a bias. Being a men's health specialist that treats Peyronie's, I obviously see more of these patients come into our practice. With that being said, I also recognize that complaint still happens at a frequency that is probably more than I had a decade ago in practice. And I really do believe it's disease, what we call disease state awareness. So more and more men are saying, this isn't normal, or there might be a solution for me. And because of that, we're seeing them coming out more. So in the end of the day, as I said, we might say a 10 to 15% window. I would push that even higher, to be honest with you.
Is there causes of Peyronie's disease? What are the causes, if any?
Yeah, there's, the kind of prevailing idea or thought is that the majority of patients is what's called repetitive microscopic trauma. So rather than a true injury, it's more of the, ooh, honey, you bent kind of in a funny way, or you came out and went back in and you kind of missed. And those types of injuries that happen over the years, leading into a little bit of almost microscopic bruising around that erection tissue that creates this problem. With that being said, also, of course, there are men who have something called a penile fracture. They actually tear the tissue, and that can result in Peyronie's. And believe it or not, even some medications from not too infrequent or not too uncommon medications for blood pressure, for example, could cause it. But the overwhelming majority of men, it's this microscopic trauma. And then one other thing, its highest prevalence is in men of Northern European descent. So we see that there's a genetic component to it as well. One of the things I always do with my patients is, if you've ever seen someone with what we could call a trigger finger, they'll have kind of a bend to their hand. It's a scarring of the tendon sheath or the similar tissue in their hands that creates an inflexibility of their finger. that's the same disease. It's the same problem. Over exuberant scar formation in an area that's being used repetitively.
Let's talk about any sort of preventative measures. Is there anything a man can do to prevent Peyronie's disease?
That's the hard part. The big thing about positional things, it's really taking into mind that transition in a position. So whether it's your partner on top or you from the missionary position or from the man in the behind position, being mindful about how you're transitioning and approaching that, and obviously in the throes of passion, you're not really calculating that out. But that being said, those are the times I see that it's probably led to this over the years. There's also information that men who have penetrative anal sex probably have a higher incidence of Peyronie's disease as well, just because of the nature of the kind of bending and the force that's kind of put against the penis for being able to insert the penis. And so, are there ways to prevent it? Obviously, I hate to say it, not having sex is the best way, but who wants to do that, right? So it's really just being a little bit more mindful, particularly, as I said, in the transition of positions. Certainly, if you have a true injury, that's the big thing. So if you do have a penile fracture, which is literally people will bruise and swell and lose erection almost immediately, that actually should be intervened on pretty quickly to help prevent that. So that is one of those things where if something bad does happen like that, definitely go get attention.
So let's talk treatment. What are a man's options who's facing Peyronie's?
Yeah, the crummy thing about active state of disease. So once you're in the process of changing, I can't tell you there's much we can do. We can control symptoms. Some men, if you look at what we call our guidelines, what the American Urology Association suggests in a panel of experts, what we should do is in patients who have active state of disease, we can treat them with something called NSAIDs or non-steroidal anti-inflammatories, what most people know as ibuprofen or Aleve. So we can treat that. There are some anecdotal stories that using NSAIDs and maybe a low-dose Viagra or other agents, supplements like L-arginine or coenzyme Q10. We used to give vitamin E a fair amount. Things like that. There's more anecdotal evidence that might work. I don't know that there's true hardcore science behind that. But in the active state of disease, unfortunately, a lot of it is sitting on your hands and waiting. When it becomes stable, once the process has gone through, then you have a bit more of open book in terms of options. And, kind of going through them from the least to the most invasive. The first one, what we've used for many years, a little bit more cumbersome to accomplish, is penile traction, using some sort of device to apply pressure against that plaque, that thickening, against the curve so it can kind of straighten things out. A little bit difficult to accomplish because it usually requires a lot of focus, a lot of time. It can work, though we do know it can help at least improve the curvature. That being said, we then tend to move towards injections as one particular way to treat this. You may hear about all different types of injections, but the most commonly done is using a drug called Xiaflex. Xiaflex actually was first designed to treat the scarring in the hands that we talked about earlier. We can use that over a series of several injections to try to essentially break up that plaque, combining it with some of the traction that we just talked about, exercises to stretch out that tissue. In the right patient, it's a very successful option that can help at least improve their curvature. In some folks, they may not necessarily be a candidate for Xiaflex, or they may not be interested in it. There are surgical procedures. Two procedures, one to kind of work on the inside part of that curve to cut open the scar tissue and patch over the area. Another is to use sutures to sort of pull against the curve and straighten things out. Both are minimally invasive outpatient surgeries that can be used to accomplish a goal of straightening the penis. And then some men who have either very severe curvature or who have fairly pronounced erection problems, we put in penile implants. Penile implants themselves can straighten the curve, or sometimes penile implants allow us then to do more complex reconstructive surgery to give the man a more rigid and a much straighter penis. So we sometimes will jump to that surgical option as well.
So, Dr. Natali, we always hear a lot of things about early detection and the importance of early detection. So, is it true that the faster someone seeks treatment for Peyronie's disease, the better?
Yeah, it's interesting. Remember I was talking about the kind of the anecdotal evidence that we have for patients in active state of disease. One of the things I tend to do with my patients pretty aggressively up front is when they're coming in and I believe they're truly in active state, they're hurting, they're seeing curvature occur. My regimen for them is, of course, putting them on NSAIDs. So, this for helping for pain control, but also for helping for an anti-inflammatory effect. Because remember, Peyronie's is over-exuberant scarring of an area's response to trauma. So definitely do the NSAIDs, but I also use a daily low dose of Cialis. So I'll put them on a low dose Cialis every day, or sometimes a low dose Viagra. Combine that with the NSAIDs. I do use L-arginine and the coenzyme Q10. I do use vitamin E. Again, I don't know that there's huge evidence for it, but I do get that started, and I do have them do some straightening exercises or more modeling what we call exercises against that area. And I have seen in my practice guys who I believe probably either stop the disease in its track from really progressing much or have had more gradual resolution or improvement in their symptoms. So I like to jump on that aggressively. The sooner we get that going, the better. In terms of the chronic state of disease, once someone's gotten that point, if they're trying to seek out care, one thing to remember is that over time, if the scar tissue is robust or prominent enough, you may start developing difficulties with erections, and you certainly will start developing narrowing and shortening of the penis over time. And what can happen is that when you then go for more definitive therapy, whatever that might be, you might be disappointed in the results because you now lost penile length or penile girth, and you get real frustrated from that. So definitely more early intervention on either the acute phase or the quiet phase of disease is important.
Tell us about how this condition may impact a man's mental health, relationship. These type of things are important, maybe not necessarily something you yourself treat, but could counseling or therapy or something of that nature help a man facing Peyronie's disease?
I think that, I don't like to try to equivocate these things. It's not the case, but I use women's health as an example for my patients, particularly when they come in with their spouse. And I will talk to them about women who've had reconstructive breast surgery. And I explain to them, I say, we women use that as a part of an identity, right? It's when a woman has whatever the reason to have a change in her breast anatomy, it really impacts them, or at least some of them, in a way that really kind of hurts their overall self-image. And we're still people that are visual, and if you feel your self-image is impaired, then that starts translating into how you feel about yourself and how you're going to interact with others. And that is an appearance thing. When you're talking about Peyronie's disease, it's appearance, there's obviously, but there's also function to it. So then you kind of up the ante a little bit in that regards, because you do kind of start feeling crummy about yourself. Certainly there are some men who have intercourse with their spouse and they're hurting their spouse because of the curvature. It may not hurt them, but it may hurt their spouse. Those types of things, kind of weigh in on our psyche. So when I talk to guys about getting treatment, certainly I keep in mind what it may do for their overall well-being, and keep that in more prominent part of our discussion to make sure that they're getting this thing addressed. Because, just as much as it's important to get it fixed, hey, there are some guys who have mild curvatures who I say, you know what, don't touch it. It is what it is. It's understanding what it can do, and to, I think, your overall well-being, it's important to talk about. So yeah, I do encourage that with all my patients.
Dr. Natali, do you have any other final thoughts on Peyronie's disease before we cap it off here?
Yeah, I'll tell you, I think my biggest thing that I can tell folks or suggest to folks is open up. I know it's really weird and scary and unusual to sit and say, hey, I have this problem with my penis, but the more that we get attention for these things, here's the thing. If you look at it in a bigger picture, we're helping each other as men get better, right? So for every person who's coming out of the woodworks who says, I need help, we learn more about this. We learn how to help them. We can support each other. We can give that guy what they need, both, in their terms of their psychological well-being as well as their physical well-being. So that's so important. So if these things are happening to you, go get attention, speak to your doctors, find a specialist who can help treat you, and know that there are solutions there. It may not be perfect, but there are solutions there to make things better.
We've been talking with Dr. Richard Natale today. He is a urologist and men's health specialist with Carolina Urology Partners. That's in the Charlotte, North Carolina region. Dr. Natale, thank you for your time today.
That's my pleasure.